Hey everybody, it's Dr. Nate, trying to give you some information on the most important things to be looking for when you're searching out an orthodontist to better your smile. The good news is you are already seeking out an orthodontist to better your smile, which is very important. Studies show that people with better smiles or facial aesthetics are more prone to being successful, have better self-esteem, better interactions with others. So the fact that you're already looking is a good sign, because that is very important in your overall kind of well-being. So there is 5 main things to look for. Number 1, know the difference between a dentist and an orthodontist. One of the main differences is the amount of experience. So a dentist goes to college, and then they go to dental school, which is roughly 4 years, and then they go start practicing. They practice as a dentist, so they're doing crowns, root canals, fillings, all that good stuff, and maybe dabbling in orthodontics, dabbling in braces. So maybe they'll see a patient, maybe a couple patients a week, a couple patients a month, braces or Invisalign. Whereas then orthodontist is a dentist who then went and did further training. So on average, an extra 3 years of training in order to become a specialist in orthodontics. So all they're seeing is braces patients or Invisalign patients. So instead of seeing maybe a couple dozen patients a week or a month, they're seeing hundreds of patients. So maybe a couple dozen a day, maybe up to hundreds a day of just Invisalign, just braces patients. So big difference there on the amount of experience that dentists versus orthodontists have. Orthodontists can actually further their education a little bit and become board certified or diplomats of orthodontics. And this is just a little bit of extra training that they will do to become the best in their field, become the most experienced, well-trained orthodontist that they can be. So the number 1 thing, know the difference between a dentist and an orthodontist. Number 2 thing is make sure that when you're getting a consult, they're taking the proper radiographs. So radiographs, super, super important. Here on this back screen, you can see this is a digital panoramic x-ray. That is very, very, very important. If an orthodontist sees you and they don't take an x-ray, they cannot give you a proper diagnosis. We had a patient just this morning who had a tooth that was hiding basically in her gums that we couldn't see. You can't see just when you're looking at her, but on the x-ray you can clearly see it. So that totally changes the treatment, totally changes how we're going to approach her. So if they're not taking x-rays, then they're missing out and the diagnosis cannot be accurate. I want to go a little bit more into x-rays. X-rays should be digital. So if you have somebody who's taking x-rays on you and they have to go and process the films and do all these other things, that is not a good sign. X-rays should be digital. It's by far most accurate, and it is also way less radiation for you. So this actually goes for dentists too. If your dentist is taking x-rays where they're not doing it digitally, then you know that you may have an issue, because if they're not doing that, then I wonder what type of equipment they're using, what type of materials they're using, if the office is outdated. So these are definitely things you should look for. So digital x-rays, very, very important. You definitely need them for a consult. If you don't have it, you cannot do a proper diagnosis. Number 3, you need to trust the orthodontist. That's really important. So you want to make sure that you're developing a rapport with the orthodontist. You don't want to kind of go in there and then maybe talking over your head or making things confusing. They should make things as simple as possible. If somebody can explain to you a concept simply, then you know that they probably don't have it all figured out in their head as well. So you want to make sure that they know exactly what they're doing, and then they can communicate that to you. You have to think you're going to be with this orthodontist for maybe 6 months up to 3 years, depending on the case. So you want to make sure that you develop a rapport with them and you can really trust them with your mouth, with your smile, something that you should be having for the rest of your life. So very, very important. Number 3 is to make sure you develop good rapport with that orthodontist. Number 4 is to know the fees. You want to know what type of fees are associated with your treatment. I don't get to deal with this as much. Our treatment coordinator deals with that a little bit more than I do, but you want to make sure you know all the fees and that they're clearly explained to you. I've seen it before where they would, the orthodontist would charge them X amount for their braces, and when somebody's getting towards the end of treatment, they'll say, oh, you know what, it's actually another extra amount for retainers, which everybody should get at the end of braces or Invisalign. So you don't want to be hit with some random fee at the end, or if you miss some appointments, or there's a lot of random fees that somebody may charge you. So you really, really want to make sure that you know that you're being charged correctly. Insurance also comes into play with this. You want to make sure that you know how much insurance you have. If you have $500 of benefits, or if you have $4,000 of benefits, you want to make sure you know that before you step in the door. So when they present you the fees, you can say, hey, you know what, I know I have X amount of benefits. Are you showing that to me, or making sure that those fees are presented to you properly? Insurance can be another YouTube video, but the idea with insurance is most insurances are lifetime max. So even before you go, you may want to connect or talk to your HR, whoever your insurance is through, and see if your benefits exist for you. So sometimes there's maximums where if you're too old, your benefits won't apply. If you're already in braces, they may not apply. Also, if you have benefits and you're in treatment, you want to make sure with the orthodontist that they were paid all the benefits max. So if you have $2,000 in benefits and you after maybe 4 or 5 months in braces, you end up stopping with that insurance, your orthodontist most likely did not get that full amount of benefits, which would make you responsible for the remainder. So you want to make sure if you're stopping some insurance that the orthodontist or whoever is being paid by your insurance has received that full amount. So the fees is very, very important. You want to know the ins and outs of the fees so you're not stuck with anything at the end. Number 5 thing to look for is you want to make sure that the orthodontist is offering the services that you want. So there's lots of different services. There's braces, there's clear, there's metal, there is Invisalign, there's lots of different types of braces. So you want to make sure that when you're stepping in there that whatever you're looking for is something they offer. Most modern orthodontists will offer you Invisalign, but some don't. So you don't want to go into an office and potentially want Invisalign, and they won't offer that to you because they don't think it's a good product. When in reality, they probably won't offer it to you because they don't think, or because they don't offer it. So they want to kind of guide you in a different direction. So you definitely want to know what type of services they offer so you are getting the best benefits for you. All right, guys, so let's recap the top 5 things you should know when you're seeking an orthodontist. Number 1, know the difference between a dentist and an orthodontist. So remember, a dentist is somebody who went to school for dentistry, may dabble in orthodontics, whereas an orthodontist is somebody who is only doing ortho. They're only doing braces, Invisalign, and that's all they do all day. So they have a little bit more experience with that. Number 2, make sure they're taking proper x-rays or records so that you get the most accurate diagnosis or accurate treatment plan possible. You don't want to start treatment and then later on they find something and it affects treatment, or they damage the teeth or anything like that. So you want to make sure you go in there, you know exactly the game plan, they take the proper records, and you know exactly what you're going to do. Number 3, do trust the orthodontist. Make sure you develop a good rapport with the orthodontist. So you're going to be with them for 6 months, 8 months, 2 years. You want to make sure that you guys are on the same page. You can talk to them, they can explain things easily, everything makes sense, and you really trust them with your new smile. Number 4, make sure you know all the fees associated with your Invisalign or with your braces. You want to know definitely that what the fees are, what they cost, also your insurance benefits, and make sure that you're utilizing all your insurance benefits properly, that they don't run out before you stop your treatment. Number 5, so make sure that they are offering the services that you want. If you want clear braces, if you want Invisalign, make sure that orthodontist offers that, because if they don't, they may try to steer you away from that just because it's a service that they don't offer. So you want to make sure that they are on the same page as you and that they offer everything that you're looking for. So once again, that was the top 5 things to look for if you're searching for an orthodontist. I'm Dr. Nate. Until next time, if you have any questions or comments, please send them below and we will talk to you very soon.